Hi, my name is David Notrica, and I'm a pediatric surgeon at Phoenix Children's Hospital. I'm also the trauma medical director at Phoenix Children's Hospital, and I head up the training program for the pediatric surgery fellowship here at Phoenix Children's. I'm going to talk to you a little bit today about how to choose your Pectus surgeon. And so not everybody can come to Arizona to have their chest wall fixed. And so you need to figure out how you can find a surgeon in your state who can do a good job for your child's Pectus. There are three main components to choosing your Pectus surgeon. So you need a surgeon who is experienced with the modern updated version of the Nuss procedure. So the procedure that was originally described by Dr. Nuss in 1999 has been improved tremendously over the last 20 years, and you need someone who is incorporating those modifications in their surgery. So we'll talk a little bit more about that towards the end of this video. The next thing is that you need a surgeon who has a lot of experience doing the Pectus procedure. So in general, that's going to be a pediatric surgeon, but it's going to be someone who's done at least 60 of the Nuss procedures. And the reason that that's important is it turns out that this operation has a much longer learning curve than other operations that pediatric surgeons do. And so while a pediatric surgeon may be proficient at most operations after doing 5 or 10, this one really takes a lot more experience, and your child will get the benefit of those previous experiences, and that's what you need when you're choosing your surgeon. But you also want to choose a program that is not just one surgeon, but basically a program where you're going to have an anesthesiologist who's experienced and nurses who are experienced taking care of Pectus patients, because they require a little bit different care than your typical post-surgical patient. Now, when we talk about the modifications to the Nuss procedure, I think that the one that's most important is got to be that they lift the sternum before they put the bars in. So what that means is that in the original operation, they would pass the narrow space between the heart and the sternum without lifting the sternum first, and they would have to negotiate that very tight space without injuring the heart. And unfortunately, cardiac injury did occur. Now, there have been 7 different techniques described for doing sternal elevation, and I don't think it matters so much which technique they use, as long as they use a technique and lift the sternum before they try and put the bars in. That is a safety issue, and that really is super important. We use a rule track technique, so we put a clamp on the sternum and we lift it up with a crane, and that's the same one that's used throughout the world to make the operation safer, and I think that's critical. The next game changer really has to do with the pain control, and that is that we do cryoanalgesia. So we freeze the nerves on both sides using a special, very cold probe to make the front of the chest numb, and that numbness lasts for about 2 to 3 months. The reason that's important is that this operation, unlike most operations, has a much longer period of time before the pain goes away. And only with this really long-lasting analgesia technique can we get the patients out of the hospital quickly and back to being pain-free and off of narcotics in a reasonable period of time. The other modifications that we do, we're super conscientious about tying the bars in, and we use sutures that go around the ribs to make sure that the bars don't flip out of place. Now, the original operation just put the bars in and secured them to muscle, but muscle actually doesn't hold suture very well. And then they came up with another modification, which was stabilizer bars, and they add some help, but without pericostal, so around the rib stitches, even with the stabilizer bars, that bar can move. That having been said, we don't think stabilizer bars are necessary, and we think that they do contribute a little bit to being able to feel the bars on the side and having some pain. So I think when you're looking at this surgery for your child, it's important that you really do the research and pick the surgeon who has the experience and has the skills necessary to get your child the best results, and at a place that knows how to take care of kids with pectus excavatum.